Hello, everybody. How are y'all doing on a Monday morning? We are back here with Dr. Parik Pilly. I don't know if y'all remember, he was the first one that I interviewed during our health summit and wanted to bring him back and ask him more questions about this second wave of COVID that's been going on. Very, very unsettling news every day. Whenever you turn that news on, all you see is these numbers. They pop up with this many deaths, this many positives, but we don't know the reason behind it. What is more information, in-depth information that we really need to know, and how can we protect ourselves? This is not going away anytime soon, but how can we move forward with what we know so far? So that being said, let me welcome Dr. Parik Pilly. If y'all remember, he is from New York. Internist practices there at Mount Sinai Hospital, and he was in the middle of all the initial stages of COVID in New York City that they have faced, and he has treated many, many patients out
Wow.
there and had a lot of experience. So,
Yeah.
welcome, Dr. Pilly.
Thank you so much, Rajitha. It's been so great. I'm so happy for you to do this. I'm always available, and I'm happy to inform as many people as possible because I think the knowledge is key. And I think just getting that out, and thank God you could do this and take the time and get as many involved. And I inform people based on my experience, based on what I've learned, what I've information from sourcing, all the different things. And I think, talking back, I think we talked back in early May was when we actually recorded the interview, and people can go look, they can see it, like what I said, or at least what I was saying at then, that this is going to happen, and that's the key. And now we're seeing, unfortunately, I think in Florida, Texas, California, California did the right thing early on. They did it before New York. New York should have shut down much earlier. California did it, and then people started going out, and the unfortunate stuff that happened, obviously, at the end of May in Minneapolis, and people were, they had anger and expressed that thing and such. Even in Atlanta, I think yourself,
Yes.
but being in those demonstrations, it's just a recipe. Any large gatherings, any where you have multiple people, when you don't know the status of those people, the virus exactly, then you don't know. That's one person. I just read an article, somebody sent it to me. I think I might have sent it to you too.
Yeah.
It took one person, 70 people they infected, the contact tracing. This is in China. And it was from pressing an elevator button. I think the WHO and CDC who were saying, oh, surface transfer is not as much, or, it's not as bad as it is. I'm not, again, not to scare. This virus is definitely serious. It's real. We're seeing that. Obviously, I think I also sent you the COVID parties article about they went to have a COVID party, and then the 30-year-old, I'm sorry, he died.
Unfortunate. Yeah.
You don't know. I know the mortality. Everyone looks at mortality rate. They say 1%, 2%. People, those real people, they have families, they have friends. Those are real people. But the other thing I think also may have mentioned was that the long-term complications. This thing, once you recover, and God bless if you do, long term, it causes, they say pulmonary fibrosis. It can cause brain damage. It can cause eye issues, like concentration issues. It just can really affect you. So the key, I say, don't get it if you can help it. I was a doctor. I had to be in it, and I was making sure I took the extreme precautions. And I can say that I've been testing regularly. That was just key as well. I do the nasal swab. I did antibody testing, completely negative. I take the precautions. But it takes just a little bit, and I think the loosening of, when I was shaking in that one interview I did before, and I think mid-April, they said they were opening up the economy. I was like, you can't, because it's too soon, and then it's hard to go back now. People were so good. It was like you got the child to listen for the first time, but once you let them go, it's just like, it's going to be so hard because people miss that. And I think that's the key. I think people don't realize that social distancing, I know it's the buzzword. It's going to probably be like the new phrase for everything, right? But, again, stay 2 meters away, wear the mask. Because, again, the way the virus enters, nose, mouth, or in the tear ducts. Oh, that's the other thing I want to say. The protective eyewear is something also. Now, I'm out here. You can see the trees back here. It's out in the wilderness. I don't need a mask. I mean, there's nobody around here. I mean, there's just like, bugs and beautiful. Actually, it's very beautiful. It's Maine, and it's gorgeous. And so, but that mask, and I think there's a consensus now among doctors, even to get to N95 level, or at least something that I think it's N90. I forget what the one below N95 is, but I think in Europe it's FFP2 or FFP1. That's their designation for the same thing. But that will help, especially in close quarters. As I said, confined areas. And again, right? Didn't I say this? Ventilation systems you have to be very mindful of. Can you see me? And then air conditioning. It can recirculate. And this virus likes cool and high humidity. But as I said before, and I've been telling people since March or mid-March or so or wherever, it's not as temperature sensitive as the flu. We were all hoping summertime, spring, sunlight. Sunlight's good, but it's just not going to. This is not the flu. It is a little weaker perhaps in the warmth, but within confined spaces, air conditioning, people going back to the office, or any sorts of things. And obviously, the demonstrations or protests. Protests against the lockdown, protests for the unfortunate, police incident that happened and has been happening around the country. It's been really tough because, again, if people can visualize this is me just talking. I have droplets, like they're aerosols. There's this contention about aerosolization. Does it carry along? So you need about 6 feet, right? Way, because either coughing, speaking, exhaling, even your breathing through your nose causes droplets to come out, and you can't see them, but they're there, and that virus can carry on that. And as far as outdoors, you're kind of protected, but you also have to be mindful of the wind because it can carry these aerosols across. So you should still be mindful, not congregate again, because I think I went to some parks with my parents, and I saw some people having picnics. Now, if everyone's testing and you all know the status of each other, the testing of them, or like they're negative, they're not carrying, great, that's important. But like, if you don't, then that's where you take the game of risk. That's where you take the game of chance. And as we're seeing in articles and research and publishing more data and patients coming in, we're seeing that, physical contact, touching the elevator button. I think we were just talking about an article about one person, asymptomatic carrier. She took all the precautions, was traveled from the U.S. back into China. They traced it back to her. About 70 people were infected. It's incredible. And I think the first patient that they found was a person who presented with stroke. I don't know if I went over the symptoms and stuff that this can present in so many different ways. And again, not to scare, but like if anything's off, vague, I think I mentioned the pulse oximeter to check your O2 saturation, because again, the pathophysiology is that it's an oxygen deficit that starts to occur. It penetrates into your respiratory tract. It goes into like the trachea, and there's like the vessels, the pulmonary vessels or arteries, veins, lymphs. It gets in the system, and then it starts just doing it. It causes what we call a vasculitis type of kind of inflammation of the entire body or different parts of the organs, which start creating mini clots that then create these what we call oxygen deficits. And then you have a collapse of the pancreas, intestines, stomach. We're finding obviously the brain, heart valves. I think we talked about all those things. And long term, I'm hearing about epilepsies, like seizure disorder, or it can even cause, again not to alarm, but partial blindness or total blindness, hearing issues, loss of hearing, just people gathering, again, social contact gathering, because, people bring so many different objects that, or you don't even realize, saliva, nasal mucus, grease, or hand perspiration, the virus can sit in that, gets deposited on a surface or an object, somebody else touches it. Again, I always tell people to watch that, what was that? Contagion. I think it's classic. They actually consulted CDC, WHO, or whoever, the experts. Textbook. I mean, I watched it like recently, and I was like, my Lord, this is a definite great educational film, because it can show you how quickly it can kind of move and how careful we have to be. So
yeah, That's very true. As you're saying, it's so hard to tell people that, if you're symptomatic, if you're the carrier of the virus. But, going back to what you have just said, we opened too early.
Yeah.
Now, here in US, the weather is warmer, summer months, schools are off, uh, kids are out partying, the college
Yeah.
children. That's why our Florida numbers are going up, because that's the destination for the
Hmm.
kids to go to the beach. How long, you know, can we live like this? Being isolated at home, is
I
that
know.
really practical? What can we do being going out at the same time, being cautious at
Yeah, yeah, it's ultimate. So, okay, so when you go to the car, it's obviously having your own car. Mass transportation is tough. I mean, still, if you have to take it, you take it. But you have to have the mask, make sure it's covered properly. I think there needs to be like they look at YouTube videos where people can show how they're properly putting on the mask. Because we get trained in the hospital, you know, you wash your hands beforehand because you don't realize once you have the mask on, you're walking around, the virus can hit, right? If they say there's virus there, it hits. So when you take it off once you get home or wherever safe spot where you're by yourself or with family, how you take that off is also important because if the virus gets on it and you're inside and you touch it and then you touch a surface or whatever, that's what happens. So
Well,
I think people
to
have
the
to
point
watch
of
you.
that mask, just stop you right there. To the point of that mask, people are not changing it, getting a new mask every day. Like if you use a fabric mask, or even if it's a
I
disposable
know.
mask, you put it on, and I've seen a lot of them, that's including my husband, on the car dashboard. You just leave it there and then put it
Yeah,
on when you go. So it's right there, and
I
more
know.
and more stuff is brewing on it. So
So
what's the thought process?
yeah.
Guys
So
on.
I try to keep it. I keep it in a brown paper bag. I kind of carry like with me, and I keep it in the car, or I try to keep it in a safe place. And like, also, if you leave it out in the sunlight, like I leave it in the car. If you leave it in sunlight, the UV can kind of do some disinfection and kind of there. And there's some machine washables. I have one which is like more not casual, but like less. It's on, and I have an N95 that I bought early on because I learned about this back in mid-February, early February. I realized how serious it was, and I said, I'm going to order this. And I was as a physician, even in the hospital, they were like, "Oh, you don't need a mask." I think everyone knows about the controversy. Like, "Oh, why are you wearing a mask? It's against the rule. You'll be fired, or you're scared of the patients." And I was like, "No, no, no." So I had bought this, and so I take that and I have it for specific areas. Go to the grocery store, very quick in and out. I try to get my list and then be just mindful of a lot of things. And I think I use the hand sanitizer, clean the steering wheel, the door handles, things obviously be mindful of the public. It has to be a shift, a paradigm shift in the mindset of we're living in this now, not post-COVID, but actual COVID world. So it's like, that's the thing. Watch YouTube videos, inform yourself, start ingraining that, much like many other things got ingrained. Brush your teeth twice a day, like you drink milk at night, or, like those things. Has to become part of our daily living now. It's just because if you think about it, if this thing can, even be more clean, I clean the kitchen now after I cook. I make sure I try to make sure surfaces. I'm just more mindful. You wouldn't understand how much of a paradigm shift. I'm a doctor, even regarding nutrition, cleanliness. I mean, these are things that you trust your doctor, know things, but we know more of the medical. You come into the hospital. I'm an internist, a hospitalist. I work there, but the day-to-day living things, I think the latest things are what I saw was like up to 3 days to 96 hours or 4 days. This thing can last on surfaces depending on certain factors, but still like plastics, steel surfaces. So this virus is a fastidious virus. It's very dangerous. It can stick around. They're still trying to find the origin. I think I discussed, maybe it was like saying it from a lab, and I had been saying that since the end of February. There was some sort of thing going on with this. So we can't treat it just as a natural pathogen. Look, there were natural pathogens. Ebola came from people eating bushmeat and such like this. But if this was being researched or experimented on or something, it was done. There's something going on. Maybe they're trying to find a vaccine for it, but I don't know. I feel a little less. I was hesitant to run those ways, but now I'm finding out more and more that this was done to do damage and long-term damage. So people have to really just try not to be negligent, try not to be, just be so mindful. Because let's be honest, many will probably have flu-like symptoms, may not have any symptoms, but some will. You have a percentage that do go, and you're seeing that. But those people who have flu-like symptoms or like they don't even have it, that is the problem. They're spreading it. That is the one that's where it's just like, you don't even know. And I've been telling, I don't know if I talked about the immunity status when you think herd immunity was a bad news, strategy, because my sourcing, even back from like February, mid-March or whatever, was saying some people will get immunity or like will get some short-term immunity, but the antibodies, like I think it's about after the infection, about 10 days after it kind of comes, but it can cause, you can lose antibodies. It's short-term, or you can have a bit long-term, more months, maybe a year, but we're seeing it can be last or like 3 months and then it's done. Then you're gone. They can't detect the antibody. So then you can get it again, or you don't have this long-term immunity that we tend to get from other viruses that we know, like EBV or any other kind of more innocuous viruses, or not innocuous, but like basically our immune system can have a long-term memory for those things. The other thing is also that this is affecting males more than females. And per what I've read or my sourcing, it's actually because there's immune system differences between females and males. Now, females are still at risk, absolutely, but we are seeing that males basically are being affected more. And then this corresponds, I think I may have discussed in the past that it was ethnicities and like between different races that was affecting more Southeast Asians in the beginning, say back December. Now you see it has spread and mutated, or different strains are now being able to attack different ethnicities as well as gender. And again, I think I watched my interview before, and I was trying to see what I had mentioned before, but all ages. I mean, this can affect, again, for pregnant women, this can affect fetuses. It can be transferred to the virus, to the womb, the fetus, newborns, children of all ages. I don't know if I had sent you that Facebook post about a family that of 4 or 5. Back in mid-March, they developed the symptoms. The youngest, or about 8-year-old boy in the family, got the mildest symptoms. He didn't even have to go to the hospital or anything like that. He thought it would recover. He's still having symptoms to this day. He can't walk. He can walk. He can barely walk a couple blocks. He gets short of breath or tired. He can barely stay in the pool. He has to go. He gets too shivery. I mean, this is the damage it can do. Now, yeah, most might not get anything, but the spread, people want to go back to their life kind of pre-COVID, they need to stay home. And it's like the discipline to do that. I can't imagine. I mean, maybe we were having a discussion. Maybe it's like families get to raise their kids again in a way. I know it's tough. We're so oriented to work and trying to, make the living. And now we're spending more time with our family and learning stuff. And I'm cooking with my parents when I can. And, we learn all these different stories. It's the sacrifices that we have to readjust and really go back to it.
I think that's more than it's benefiting us because, as you're spending more time with your family, you're bonding and learning new things, your family history that you do not know. Normally it would be like a rush. You get out, you visit your parents and, go back to your work routine.
Yeah.
Talking about children, I just had a question on that. Now that the schools are reopening, the kids are going back to school, the college kids are going back to their universities, and school-age children here in Georgia, we start up in August. How much do they really understand and know, no matter how much you let them know, even when you're spreading kids apart in the classroom?
Yeah.
One teacher trying to tell them, kids are kids, you can't expect, you tell them, you explain to them.
I know. So, that's the toughest part because look, you have so many factors. I said, right, the ventilation system within the schools itself is an issue, right? You get one child and, children, I think I said it in the past, I said in some other interviews, or I've been in correspondence with people that they were the great hidden spreaders in the early part of this year. They were getting it largely immune, but they were spreading it. And now the other information I've gotten is that we may not even be able to medically or virologically detect it in children. So that adds another thing, because we're depending on the COVID swab and the nasal swab antibody testing. Now you send them back to the schools, even just apart, and they may test negative. Like this child, the one I said, he said he tested negative. The 8-year-old kid that's still having it to this day. The only thing they had was that on the chest X-ray was a little bit of a hint of maybe COVID-like pathology, parabronchial thickening. They said. So with children, I honestly, going back to school right now, for me it's like, one, you have the circulation. One, you can't tell if they have it, and then are they gonna even respect the social distancing? How you can tell children who are 6, 7, 8? I mean, I remember myself. I listened. Actually, I didn't want to get into trouble. I hated getting the shame of being yelled at, or at least being reprimanded. Everyone looks so. But I mean, there's other children who didn't care, and they would just do whatever. So you have to deal with that, and you're asking adult staff. I don't know how old they will be, but you're also asking them to be put in things. I think I just read an article. 3 teachers or something, they were teaching in the class. 3 of them got infected. 1 died recently.
Yeah, because so much with the kids, they rub their face. It's hard to. How many times are you going to say, "Don't touch it"? Is that really realistic in terms of that? And with the testing that you had just mentioned, how accurate is this testing? And also, same with the antibody. We are getting done. I've had some friends who directly worked with these COVID positive patients.
Yeah.
And antibodies came back negative. And the testing, a few weeks ago, one of my son's friend, he got tested. It came back positive, and everybody was notified. Everybody got tested. But then 2 weeks later, they came back and said, "Oh, that was false positive."
Right.
And then the delay in testing, as we are testing more and more, it's taking 2-3 weeks. You go get tested, and you're back to your routine. You have the result, and the result that comes, it's not. I mean, this is so confusing. There's so much of information out there that is not 100% reliable.
Right.
And we are expecting people. What can we as public health, people out there, what can we tell people in a very simple way that they can understand? These are the things, yes, hand washing, putting the mask on, and all of that. That's with anything, even with flu.
No, absolutely. So it's funny. I'll be honest, with flu, I would always get the flu shot. You have to do it being a healthcare worker. But I would, I wouldn't wear the mask. I would definitely wash my hands and all that stuff. But and they always have the things nearby the patient room. You do it. I don't know what it's going to take, because I think people have to realize the long-term complications, because it's going to come from the adults, right? The parents and family members that have to inculcate that into their children, and then it has to come. There has to be again, I say, a mind shift, a paradigm shift, and to understand that masking's got to be almost I think it should be mandatory. I mean, it should be mandatory outdoors within reason, right? If you're going within group areas, touristy areas, like, those kind of things have to be mandated. Like, I think, unless there's some extenuating circumstance, of course they have to, but that will help tremendously. And it has to just become a part of our fashion, way of life. I don't know, like an understanding of what it's going to take to prevent the spread in this initial part. And as far as like, I think nutrition, I think we have to get back to, like, I there's a lot of doom and gloom. I know I'm saying a lot of stuff, but like, and what I've learned is that the immune system is so key, right? If you have a strong one, you can kind of, if you get it, you can kind of, your body has a better shot at, keeping it away. Because as I said, people who've even recovered, they still have long-term, issues or complications that, I've read include like cancer, even body and like general deformations that they can't even understand. Like, people don't understand, like, this can happen like long-term, epilepsies, allergies. But how do you prevent that is to keep the immune system strong, to keep yourself healthy, a positive mindset. I think we talk about meditation, good breathing exercises. Again, we can go into nutrition a little bit more. I think we'll talk about it a little later. But if we can keep a strong immune system, I think like lack of vitamins and supplements, because I guess our food production, the way food is produced today, it's not the same as, say, when we used to have cultivation. People used to grow in their own garden, or you had old McDonald farms kind of thing. Now everything's very agribusiness, right? Like it's a lot of that stuff is taken out. So if you can eat, I take vitamin C daily. I take vitamin C, D, vitamin K. These are all important parts, and a good multivitamin, omega-3, that keeps the blood thin, because again, I told you that like this creates micro clots and even bigger clots it can lead to. And so you can prevent that, keep your blood thin and not susceptible to that. It can help long term. I think, when you're staying in these closed rooms, right, and for long periods of time, especially in schools, in these classrooms, you just have to just take a lot of care, keep the 2 meters. I think if they can do exercises to make it almost like a game for children, where they can you kind of like can get them to play along and understand how important it is. I mean, we have to give credit more to children than we realize, that they can pick up on things and understand why it's important. If you instill that at a young age for them, then they'll carry those on. It's going to take another generation to really, I don't want to say generation, but like it's going to take a year. Like this is not something we can unfortunately not get through quickly. We just have to be disciplined,
As
I
you
think,
said,
yeah,
that yes, kids can understand more. They're more resilient and all that. It's more with the parents, how they coach, how they talk about it, and about that fear, whatever they install. Because I've had some parents come and say, oh, how long are we going to stay home? Kids are being depressed. It's how you say things, how you approach them, how you explain
yeah,
to them. And you hit great points in terms of nutrition, mindset, the way of thinking, the meditation. All of these things we addressed in our last month
yeah,
during the health summit, which we are going to reiterate all that stuff again now that we are in this another phase of it going so viciously. People forgot. They thought,
yeah,
okay, it's over and done with. We are not over with it. As you said, for a long time to come, we just need to adopt this way of living. People
right,
always ask questions. It's like, okay, you're saying all these things because I address all these things in my coaching program. My doctor never said that. My doctor never talked about
yeah.
nutrition or any of that stuff, because the first thing they get is a prescription when they go. I'm sure in the hospital, do you have that much time to talk to your patients on your rounds when you're talking to them about their issues?
So for me, I work as a night nocturnist, so I do admissions and I do quickly, and I'm unfortunately not involved in discharge, and that's why I do a lot of this stuff. I've been emailing people. I try to talk during the daytime so it can get out in social media. It's like I sent like my tax person, like, oh, here's some videos I did just in case. Like that's the best way I feel I can do it. I think our social workers, discharge planning, RNs and such, that we're understanding more, since we were so early back, like in March, or end of February, March, we were getting the cases in New York City. We've learned so much about it, and so I think that is being installed. Like how you have discharge instructions for congestive heart failure. You make sure if you have a weight gain, you take another low 6. Make sure don't eat as much salt. All these things. I think that's also happening with coronavirus, because it's funny you just mentioned, you said the second wave, and I think I was saying it, but the second wave, the first wave never finished. The initial outbreak never finished. We're actually going to peak. I think we're going to peak soon. And, the latest sourcing I said, the second wave, we don't know when it's going to happen, because this thing still hasn't finished. It hasn't really finished. I think we saw things going down, but it really plateaued more than anything. And I think what we did initially, even though per my sourcing, they were saying it was halfway effective. It wasn't always, but at least it was something. at least the lockdowns was something. People were staying home. It reduced it. We saw it. We see cause and effect, right? And if we need to continue those, I think they need to start shutting down at least hotspots, quarantine hotspots. Um, you know, I was saying only essential things, right? I think the reopening of the economy, the international trade, the goods transported. I mean, people traveling, they're going again, right? They're holiday traveling, their tourism. Um, I forgot to, I don't know if it's safe for work, but like even I was saying this to a friend that it could be found in actually in sexual fluids, semen. And they're saying with people's their sexual encounters, this is like somewhat could be like HIV. I think certain strains, and with unfortunately the prostitution that occurs, illegal or not, that's also transmitting. All these things are happening. It's really gonna be hard for I think what countries and local districts, Atlanta, state, Georgia, anywhere else, they need to start restricting things again. We go back. I know it's gonna be starting hard and people want to go back to normal, but it's getting out of hand because it's so infectious. It's getting,
As you're talking about that, I was just thinking about it. This is public health crisis, but it shifted to politicians' way of playing a ping pong game. It's not about politics; it's about our health, the public health.
Absolutely.
But this is what, like in Georgia here. Okay, Atlanta mayor said we are going to go back to reporting, closing off stuff, and then the governor disagreed. So. Uh, because they both belong to different parties or whatever they belief system, whatever they do, but we are not getting the true information out to the public.
I
And
know.
same thing with the scariness. Whenever you turn the news on, some people are glued to the news and they post all these numbers. Oh, this many tested positive, this many died. That just scares people without much underlying information.
And trend, yeah.
Behind
Well,
those
I mean, I hope. Well, that's why I hope with us talking and the people who may watch this and we can pass it along to our family and friends that they'll get more. People have been listening to me, but then even my parents, like, sometimes they can, yeah, you're right. But like, it's like until it happens to you, it's like not in your backyard, right? Like that's what it feels like. NIMBY, they say. But I think again, doing these things, talking about the seriousness, seeing that, as I said, some people will get asymptomatic, but as I said, long term, this can do so much damage, even unbeknownst. I think we're still not recognizing that. Holy cow, like pulmonary fibrosis, right? That's kind of an obvious one that happens from it. But again, the brain damage I mentioned before, or let me see, I mention, I said seizures, I said heart disease, heart failure, and even in children, this is happening in children too. And like basically all sorts of allergies, like even cancers or something. I mean, these things, or diabetes, type 1 diabetes. I read an article and I meant like, this is happening in people who never had this, or even recovery from previous illnesses. They had immunity that could be triggered by this. That's the problem with this thing. If we can understand, hey, yeah, you can recover, but this can stay in your system. And if you don't take care of yourself, you don't keep your immune system strong, like by keeping your, gut and, eating right, exercising, metabolism, long term you can get, blindness. And people don't want to go blind. They don't want to go lose hearing. They don't want to lose all these different things. So I think I even have to say to my parents, I have to be so serious with them. Like, this is why this is it. Like, this is why this is important that you do these things. Like, my father's a cardiologist. He is opening his practice again. He's going to see 1 or 2 patients, but he has to take extreme precautions. Test your workers. Ask your patients to get testing. Ask you yourself to get testing. I try to do it once a week. I try to get it, as best as I can to, be mindful of I'm interacting with people. I need to take the responsibility. I need, it's an ethical obligation on our part to do these things. And basically, I think a good protocol, if someone would take it, if you get exposure, get testing. It multiplies in the nose and the mouth. That's where it's like really finds a nice sweet spot. But then it can somehow get down at the trachea and get in. But so the COVID swab is getting better. It has improved. Early on I was saying, I don't know, 70% accuracy, 30%, up to 30%, whatever. But get it, isolate it for at least 30 days. So I have been saying, everyone says 2 weeks. 30 days, especially if you're asymptomatic, because the incubation period, as I've been saying, 2 weeks to up to a month to 3 months, right? It can be in certain cases because the way it works, this thing is not, it doesn't quickly, in certain people, it doesn't quickly. And I think that's the problem. The asymptomatic people still go around. And so I think I had been asking for hermetically sealed quarantines. So now hermetically sealed means airtight, like sliding doors, negative pressure and ventilations for people who are either asymptomatic, mild to moderate. These people I need to be quarantined in some way in a facility and treated as well. If they start to develop things, that's the key. If you can retrofit old places, quarantine, we need quarantine centers, treatment centers just for COVID, so you don't spread the infection, because even within the hospital it was spreading, right? That one out of that led to 70, the other one went to that person who presented as a stroke. I said, I mentioned how many different ways that this thing can present. So they said, okay, contact tracing. They said stroke. Oh, this infected this other person. How did he? Because they were running to dead ends. They were trying to find it, and they found that one person traveling from U.S. back into China, asymptomatic, touches the elevator button. The child touches it, gets it, spreads to the family. Family spreads. I mean, that's it. That's the key. But what I tell my uncles and aunts and everybody else, if you have any symptoms, let me list some symptoms. Beside the fever, shortness of breath, dry cough, right? That's the standard. That's the typical. There's atypical. Speech difficulties, loss of smell, we know, right? Loss of taste, headaches, discoloration of fingers and toes, movement problems, visual difficulties, even conjunctivitis, kidney problems, constant fatigue, diarrhea, skin issues, loss of taste, we said that, sore throat, pressure in the chest, allergy attacks, pain in the limbs. I mean, I'm reading a list. Loss of orientation, loss of concentration, control. Not to scare you, but any little thing, please let us know. Inform your doctor. I even tell my, please contact me. People I don't even know, coworkers, their grandparents are feeling this way. Let me know. Figure it out. And it's just going to take each individual that become social cohesion. Me working with you and other doctors, just talking about it, getting it out. You're absolutely right. The media, needs to really focus on our public officials and the health organizations, the local DOHs need to get that seriousness now. I don't think people realize that the morbidity, not just the mortality, which is obviously the ultimate, you don't want to die, right? But morbidity long-term is the biggest problem with this, really, even beside the mortality, because they keep saying 1%, less than 2%. We don't know.
The percentage doesn't mean unless it hits you. There could be so many percentages. So the message here is any change in condition, be very cautious, go get tested, make sure you're following, sanitizing your hands, washing frequently, putting the mask on, putting the goggles on, getting those masks cleaned on a regular basis, cleaning out the counters, anything you touch. So you don't have to wait for a public official to tell you, hey, we are this city is mandatory mask wearing or any of that. You have to take your own responsibility.
Right.
For your health.
Right.
If not, this is not like you have these symptoms. You could have this long-term effects of this, which are not going to be very pretty down the road.
Right. No, it's again, that, understand how this transmits, understand what it does to your body, understand what you need to do to prevent that, and then understand, okay, if we know the incubation period is 2 weeks to 1 month, then we know that lag. See, I think we talked, early May? And I was saying these things. Look at where we are now. It's there. I mean, people, and unfortunate incidents happened. People were demonstrating. They were all together. I mean, they were wearing masks, but even the eyes.
Quite a few were not wearing masks. Even though you're wearing masks, you're so close vicinity to each other. And those fabric masks are not really protective anyway.
Right.
So I wanted to ask you, there is no way, if you're going to get it, you're going to get it. But some people are able to better handle it when they get the virus versus others. So what can we do? How can we prepare our body so that we are able to better shield ourselves against the virus? How can we protect ourselves even though we get it? what are some of the things that going forward, not just for this virus, any infection, any virus that comes our way, what
Right.
can we do to so that we are able to better handle it?
In terms of, I think again, keep the immune system strong. So how do we do that, right? It's like all about digestion, and I say metabolism, right? Metabolism. You need a moderate amount of exercise. I say 1,000 steps after meals. Like try to get 1,000 steps after meals, or do some sort of even manual labor. I think if you're gardening, that's great. If you're doing something where you can do that, do those things. Food wise, natural. Try to keep away preservatives,
Okay.
processed foods. I cut out all that. I cut out soda. I know you're in Atlanta, Coca-Cola. Cut that out. That's like that leaches calcium. Calcium is so important. Vitamin D is so important. Getting some sunlight, but I take vitamin D still because even with darker skin, I have to be out in the sun a little longer to even absorb and convert that. Vitamin D is so key. The antioxidants, vitamin A, E, C. Read up on these things. The B vitamins. What else? I take spirulina. Spirulina is excellent. Spirulina is a great additive supplement. I take biochlorella, moringa. Moringa is actually a tree found in in India. Excellent source of calcium, immune system, vitamin C. Perfect. As far as mental things, I actually did some breathing exercises. My mom does some breathing exercises, I think, through it's the art of living, Shri Shri. I've done that. I've learned it. I do it myself now. I do meditation. I try to do meditation. I'm trying to be better. But mentally aspect is very important. You're very right. Again, I think mentioned it is psychoneuroimmunology. It is very important to have a good mindset. It's tough. I've talked to colleagues, friends that have gone through it. They're saying you don't know what each day brings to you. You think you've recovered, all of a sudden another thing happens, and you just mentally can really shake you. And I think there was this unfortunate doctor, was a friend of a friend, the ER doctor, Dr. Breen, just probably another article about she mentally got it and she felt like she wasn't being able to help, and she just unfortunately took her own life. This is so tragic, and
Yeah.
it's hard for our ER doctors, the ICU doctors. We're trying mentally. It's not an easy thing to see this happening. But why I try to keep a smile or try to keep positive thoughts is I know there's easy solutions for these, and by these keeping my immune system strong, eating yogurt, kefir, apple a day. It's true. The adage is true. Apple a day keeps the doctor away, right? The apple is great, or any kind of the red onion or red grape. It has a quercetin. It has read, inform yourself. As doctors, we don't learn much about nutrition. I mentioned Ayurveda was something that I learned to understand about more about meals, when to eat. Eat more frequent small meals rather than large meals, because then large meals can overwhelm the system. Rather than eat frequent but smaller meals. Go to sleep, get rest. Exhaustion. Mental rest is important as well. Take the time, learn those things. I'm trying to think what other vitamin supplements I take that are turmeric. Omega-3 is very important. Omega-3, you need it. I cook with coconut oil too. What is it?
Too
Cold
much
pressed.
fat in it.
Yeah.
With the coconut, I know there's so much hype with the coconut oil. That's way too much fat in that with the coconut oil thing.
So no, it doesn't get absorbed. So I've read, and my sourcing is it reduces cholesterol. It absorbs. It has medium chain triglycerides. It does it allows great absorption. I live by it. I've been on it, and I feel better. Maybe it's mental placebo, but
Yeah.
that with olive oil and butter, I try to stay away from canola oil. Canola oil is basically industrial. Like it's basically a cause of many arthritic, diabetes. I think it causes long-term damage. What I've read, the canola oil, stay away from that. Like anything where you can't get cold pressed, and even when you cook it, right? We fry things, like we try to stay from fried things. It's hard not to fry, but you think about what you're doing chemically. I was a chemistry minor in college, but you're breaking stuff down, and that's going to lead to oxidization, and that causes a lot of problems long term. You take it in. And look at what McDonald's did for many years. They cooked in animal fat, then they went to like vegetable oils, and these are things we have to keep figuring out things. And I'm pretty strict about it now. I'm for the future, I'm going to keep doing it. And this is for also the coconut oil is per my sourcing. That's been really reliable on a lot of this information that I've been telling you from back of end in February. They were saying coconut oil, excellent, but you have to get it cold pressed, high quality, organic. For me, I'm going to trust them with that in that respect. So, um,
So, what you're saying is we need to make sure we are healthy by eating good, nutritious food, no processed food, without
yeah,
any additives, without any preservatives in it, close to natural as possible,
absolutely.
so that we are strong and our mental thoughts, how we think, and our slowing down our breathing and paying attention, awareness, being mindfulness. And
Right.
people can do it. Sometimes not everybody can do it by themselves, but when they cannot, they can always reach out for help. There
Yeah.
is a lot of help available, so that you are staying in sane mind.
Right.
So
That's important. So important. The mind is so important on that. The mind of thoughts. I mean, it can affect your physiology. Absolutely. I believe it. I come to understand it. I reason through it, and I think that's absolutely a great thing to say. Um, just good positive thoughts, just mentally. We have in Indian, obviously say mantra, which is the instrument of mind. I think it translates as such. And clearly, you can use anything. You can say sugar, sugar, sugar. Although you shouldn't eat as much sugar, of course, but come up with something and have it. I say soham is in Sanskrit. It's like
yeah.
we in, out, ego out. I think it's the way it goes or something. But anyone can use anything. It's not. They don't
Whatever
have to be
works for
Indian.
you, it's not one particular thing. That's the key thing. Whatever works for you, however you can, make sure in your current lifestyle that fits your needs and your family's needs. So
Right.
that, that way you are staying healthy, and try not to spread it to other people. Be conscious of that. So
Right.
that being said, that was a lot of information that
I
we
know. And
provided.
I actually find your pets, cats, dogs can carry this and transmit it. You can go wastewater. When you have sewage and stuff. I forgot to mention urine. Just be mindful when you go to public toilet rooms, flushing. I think we mentioned that, but people, cats and dogs, they can carry it. Mammals can carry it. Insects can carry it. So just be mindful, be clean, be healthy. All the things that we always talk about, those adages, like I think even, gurus tell us all these things or we read it. It's true. It's so true. Keep hygiene, personal hygiene, teeth clean, gums, because the mucous membranes within, it's called buccal mucosa. I think that's how it gets it. Because the other thing, cut open foods. The open moisture on the foods can also cap it. If someone's infected preparing your foods, be mindful, wash it. It likes moisture. It likes the cut part of the meat, or especially meats. So, and be mindful. I know people, I try to tell my mom who's vegetarian is excellent actually, because you tend to eat more but try to get she drinks milk. Milk is excellent, but also you have to combine, I think it's not the greatest with calcium necessarily, but as opposed to what they say, I know it's a little controversial, but it's not, no, vitamin D, linoleic acids, those are great, and in butters and such. But the calcium is important, so they should basically. I supplement with moringa. I take moringa capsules. I drink milk still. I love milk. I mean, I drink
Vegetables
yogurt.
also have a lot of calcium and plenty of protein and calcium that we do get
Yeah,
from vegetables too. So,
yeah, absolutely. Vegetables are so important. Alkaline, acidic. Balance those, and you'll be good. You'll be really good. Yeah.
all right. Thank you so very much.
Thank you so much. My battery's about to run out too. I was like, oh no, how much longer is going on? But I appreciate it. I appreciate always discussing this with you. I think, if anything, people, again, hermetically sealed quarantine space, please call your local DOH. Say, hey, why aren't we quarantining these people in a certain place? We had the time, put treatment centers there. That's the most important thing. I have videos. We maybe put links in the video itself or wherever they can go at. Advocate for these things. Advocate for. We need some more strict lockdowns. We need to do like hotspots, mask, universal mandatory masks. Think about protective eyewear, especially healthcare workers in office spaces. Think about your air circulation, ventilation systems. This can persist in those areas. Air conditioning systems. Don't disavow that. Don't realize those things. And long term, this can cause complications of all kinds, epilepsies, cancers, and stuff. So we don't want this virus in your system if you can help it. But don't despair. Keep your immune system strong, mentally strong. Those are the things that are important. So don't despair if you have it. just be mindful that you can spread it if you're asymptomatic, or even if you've had this mild flu. A lot of people think they had a flu or a cold, but it might have been that, and then they spread it to others. So children can have it. They cannot get. I'm hearing that it cannot even be medically or virological detection in children, some children. So they could have it and they can still spread it. So these schools opening, bad news. I think they have to figure out a different plan for now.
Yeah,
Sorry.
what we can say is, take charge of your health, be responsible, and educate others, spread love and joy, eat
Yeah.
natural food, nutritious, enjoy nature. All right. Thank you very, very
Thank you
much.
so
We
much. Thank
appreciate
you.
your time.
Yeah, enjoy nature. This
Yeah.
is it. Take care. Thank you so much.